Welcome to Clinical Minute.
HPV vaccines, improving uptake and compliance. Emily is a 12-year-old girl who has just entered the 7th grade. She has come to your office today with her mother for an annual checkup. As you review what today's visit will entail, you mention that Emily is due for her preteen vaccines, which include tetanus, diphtheria, pertussis, also called Tdap, meningococcal conjugate, known as MCV4, and human papillomavirus, or HPV. When the nurse takes Emily from the exam room for height and weight measurements, her mom says to you, "I've heard of the HPV vaccine, but I'm just not sure it is necessary for Emily." You know that a key driver of acceptance of HPV vaccination is a recommendation from a clinician. You continue the discussion by strongly advocating for vaccination for Emily. Despite numerous studies that show the effectiveness of HPV vaccination, national data demonstrate that fewer than 50% of clinicians consistently recommend HPV vaccines for 11 and 12-year-old girls. Uptake and completion rates of HPV vaccines remain significantly lower than other adolescent vaccines. It is a missed opportunity when girls receive other preteen vaccines but do not receive an HPV vaccine. If an HPV vaccine had been given with other scheduled inoculations during health care visits in 2012, coverage of preteens receiving more than one dose of an HPV vaccine would have reached over 92%. Instead, coverage was just under 54%. There are two HPV vaccines available in the United States: the quadrivalent vaccine with the brand name Gardasil and the bivalent vaccine with the brand name Cervarix. Both vaccines target HPV types 16 and 18, which cause 70% of cervical cancers. HPV 16 and 18 also cause many precancers and cancers of the vulva, vagina, penis, and oropharynx. Also, 90% of anal cancers are caused by HPV 16. Gardasil also protects against genital warts by targeting HPV types 6 and 11, which are responsible for 90% of genital warts. You explain why HPV vaccination is an important tool in preventing cervical cancer, as well as other anogenital cancers. You inform Emily's mother that infection with HPV and HPV-related diseases can be serious. 50 to 80% of sexually active adolescents will have an HPV infection within 2 to 3 years of initiating intercourse. Among high school students in the United States surveyed in 2011, about 47% had ever had sexual intercourse. By age 50, 80% of women will have had an HPV infection. If the infection is not cleared by an immune response, abnormal cervical cells and cancer can develop. Emily's mom expresses concern about the safety of what she views as a new type of vaccine. You explain to her that there are many misperceptions about the HPV vaccine. In reality, the safety profile of HPV vaccines is very good, and the most common side effects are mild and not serious. In the United States, vaccine safety is monitored and evaluated by federal agencies, as well as vaccine manufacturers. From June 2006 to March 2013, approximately 57 million doses of HPV vaccines were distributed. Of the 22,000 adverse events reported in girls and women who received an HPV vaccine, 92% were classified as non-serious and included side effects like pain, redness or swelling at the injection site, fainting, dizziness, nausea, headache, fever, and hives. The most frequently reported serious symptoms were headache, nausea, vomiting, fatigue, dizziness, syncope, and generalized weakness. Safety data continues to be collected. Healthcare professionals and patients can submit potential concerns to the Vaccine Adverse Event Reporting System, VAERS. The VAERS system is co-sponsored by the Centers for Disease Control and Prevention, CDC, and the Food and Drug Administration, FDA. Emily's mom inquires if there is any evidence that girls who get an HPV vaccine become more sexually active. You assure her that several studies have shown no association between HPV vaccination and increased or risky sexual behavior. You also mention that this could be a good opportunity to begin or continue conversations with Emily around sexual health and responsibility. "But isn't Emily too young for the HPV vaccine?" asks Emily's mom. This question gives you the opportunity to explain why it is best to vaccinate before Emily is exposed to HPV through sexual activity and while she is still young, which allows for a better immune response. Both vaccines are approved for use in girls as young as age 9. The Advisory Committee on Immunization Practices, which is a committee of the CDC, recommends initiating HPV vaccination at age 11 or 12. Gardasil also can be used in boys as young as age 9, as well as for catch-up in young women and men through age 26. Cervarix can be used for catch-up in young women through age 25. HPV vaccines can be given to girls and young women who have already been sexually active, have had abnormal Pap tests or positive HPV tests, or have had previous treatment for cervical disease. However, data do not indicate that vaccination will have any therapeutic effect on existing cervical abnormalities or HPV infection. Patients who have been infected with one or more HPV types still get protection from the vaccine types they have not acquired. Healthcare providers should not use Emily HPV testing as Emily's mom feels comfortable with having her daughter vaccinated for HPV. You explain that some young people feel faint when they receive any shot, especially if they have not eaten or are anxious about needles. You tell Emily that she may choose to lie down or sit while she gets inoculated. Emily receives her vaccines and is instructed to wait in the exam room for 15 minutes. You check on her after that time period to be sure she is feeling well enough to leave. While Emily rests, you remind Emily's mom that although the HPV vaccination is very effective, Emily will still need to get screened for cervical cancer in the future. You notice in Emily's chart that she has a 9-year-old brother, so you mention to her mom that you recommend he also get the HPV vaccine when he is 11 or 12. Letting parents know about upcoming vaccines offers them time to absorb the information and formulate their questions. Starting the discussion early also helps create a preteen vaccine expectation similar to the well-established regimen for the pre-kindergarten group of vaccines. You explain that the quadrivalent vaccine, Gardasil, is recommended to protect males from HPV-related diseases. For males, the HPV vaccine is used for prevention of anal cancer precursors, and genital warts. The vaccine could potentially prevent precancers and cancers of the penis, as well as oropharyngeal cancers caused by HPV types 16 and 18. At this time, however, there are no conclusive data on efficacy of the vaccine to prevent cancers of the penis or oropharynx. You remind Emily's mom that all 3 doses of the vaccine are needed to ensure effective protection against HPV. It is recommended that the vaccine be given as 3 intramuscular doses within a 6-month period. Gardasil should be given at 0, 2, and 6 months, while Cervarix should be administered at 0, 1, and 6 months. Scheduling the next 2 doses at the time of a patient's first appointment is a good way to encourage completion of the vaccine series. If a dose is missed, it is not necessary to start the vaccine series over. In this case, the doses should be completed by 12 months. If the original vaccine type is unavailable, a different HPV vaccine may be used to complete the series. You mentioned to Emily's mom that you understand how busy families are during the school year. Also, you tell her to anticipate some resistance from Emily in coming back for her subsequent doses if she experienced pain or discomfort during or after the first dose. With that said, you emphasize the importance of vaccine completion for both of her children. Before they leave, your front office staff works with Emily's mom to schedule appointments for her second and third doses. Of teens that start the HPV vaccination series, only about 1 in 3 complete all 3 doses. Coverage with 1 or more doses increased from 25% in 2007 to 53% in 2011. However, there was relatively no increase from 2011 to 2012. In 2012, only 54% of girls received 1 or more doses of an HPV vaccine, and only 33% received all 3 doses. Setting up recall or reminder systems using a patient's preferred method of communication is another way to encourage vaccination series completion. Your office staff asks Emily's mom whether she would like to hear from you by phone, email, text message, or with a reminder postcard. Establishing effective office procedures helps maximize vaccination uptake and completion rates in a practice. Front office staff should be educated about the importance of completing the vaccine series and instructed to closely monitor the records of patients who begin the series. They should follow up with patients to ensure they receive all 3 doses. It is also helpful to provide staff with educational materials and other patient resources so they can address concerns and answer questions. Addressing the factors that drive a patient's decision to get an HPV vaccine will help improve vaccination uptake and reduce the rates of HPV infection and HPV-related diseases. Demonstrate the need for the vaccine by helping patients to understand the serious and prevalent nature of HPV. Discuss the diseases caused by HPV, including cervical, anal, vulvar, and vaginal cancers. To highlight the vaccine's effectiveness, let your patients know that HPV vaccines can prevent most HPV-associated anogenital cancers. Take the time to educate your patients on the solid safety profile of HPV vaccines and the fact that adverse events from the vaccines are rare and generally mild. Remember the importance of your recommendation as a clinician. By strongly recommending HPV vaccination for girls, boys, young women, and young men, you help your patients feel confident that they are making the right healthcare choices for their children or themselves. As Emily's mom leaves the office, she thanks you for taking the time to explain the benefits of HPV vaccination and to reassure her of its safety. She says, "I feel good that I can help protect my daughter and my son from HPV and some cancers."